Hi, my name is Walter Miranda and my topic is the physical therapy referral from primary care for acute back pain with sciatica. Definition: back pain is the second most common reason for a primary care visit and the costliest medical condition in the United States, with an estimated 114 billion spent in 2060. Sciatica is a condition that accompanies some case of low back pain (LBP) and is characterized by writhing symptoms in the leg. In the most cases, sciatica is attributed to lumbar disc disorder. Sciatica is estimated to occur in about 30% of LVP episodes, with an annual incidence of 1% to 5%.
Sciatica. Sciatica is I often think of sciatica more as a syndrome rather than as a pure diagnosis in itself, and I'll explain why in a second. But sciatica is commonly where the disc itself compresses on the nerve in the lumbar spine, and that affects the functioning of the nerve, in which case you either have pain or changes in sensory or motor ability down the leg. Now, the interesting part about sciatica and why it can often be described as a syndrome is it is not always the disc that causes those changes to the nerve. You can have restrictions on movement, specifically within the foraminal space where the nerve exits the spine. Tethering or adhesions along the pathway or the track of that nerve can again restrict the ability or affect the ability of the nerve, which again can produce sciatic-like symptoms. Compression from soft tissue, such as muscles which are tight, or sitting in an awkward position or on your wallet or a number of other aspects, can again compress on that nerve and produce sciatic-like symptoms for some people. We can often have what's referred to as a double compression syndrome, which is where 2 points along that channel that the nerve runs are restricted, and the combination of the dual restriction causes sciatic-like symptoms. The last one, which is also a possibility, is that the nerve itself is irritated or inflamed, such as in a neuritis, which again would cause pain up and down that leg or along the distribution of the nerve, again producing sciatic-like symptoms. Common presentations, as we've touched on, is pain in the spine that radiates down the back of the leg. Typically, it does only affect one side. If it's affecting both sides, then it does raise the concern level that a therapist would have, and we would be looking to really ascertain what other things are potentially going on. Pain areas, as I say, back, buttocks, hip, and lower extremity. The pain can be mild, it can be severe, it can be sharp, it can be lancing. So there's a number of descriptors that are often used to describe sciatic-like symptoms. Numbness, pins and needles can be present. Often people talk about them within their foot, specifically toes, ball of the foot, again depending specifically on the nerve and the pathways which are being affected. Burning sensations, leg weakness, and limping are also other common findings for this condition.
Applications in physical therapy. The approach was designed to programmably reflect physical therapy care for LBP and sciatica. Exercise and manual therapy intended to drastically diminish sciatica symptoms were considered more core component of physical therapy protocol. The exercise program used principles of mechanical diagnosis and therapy. On the basis of mechanical diagnosis and therapy principles, each session began with an assessment of symptom response to repeat of something movements of the lumbar spine. Movements or position that centrally or morph symptom toward the spinal midline from the basis for exercise recommendations. For patients with LVP and sciatica, lumbar extension exercises are often most effective for centralizing symptoms.
Hi everyone, Dr. Diane here at LaPorte Orthopedic and Balance Therapy. I'm back with Peggy, and we have some tips for you if you have back pain. So, here are 3 modifications that you can try at home to see if it helps with your back pain. So the first of which is, if you have a tendency to catch yourself either sitting or standing with a slouch, or maybe you stand with a hip popped while you're talking to people, something like that, what that does, let's say you're in more of a slouch position, is it takes the spine out of its sort of natural or neutral alignment. So if you catch yourself doing that, I would recommend trying to essentially straighten things out of it. So the way that you can do that is to bring your shoulder blades down and back so that they're a little bit closer together. And you can imagine elongating your spine like there's a string and you're pulling the string. Peggy just grew about an inch there. And so giving your body an opportunity to have more of a neutral spine can sometimes help with back pain. So the second thing is, if you find that you sit a lot, so let's just say during the day at home, you find that in front of the TV you tend to sit, and when you have your meals you tend to sit. If you try moving around more, so taking that periodic walk, getting up, shifting your position, and just getting your body moving can often make a difference when it comes to back pain. A good example, I think, is when we have a long car ride. If we're going on a trip somewhere and you're basically trapped in your car for hours on end, the back almost always has a tendency to start to become uncomfortable. And it's just a sign of the body wanting to move. So something that you can try at home is just get up and move around a little bit. You don't have to go for a 10-mile walk or anything crazy. Even just walking around the house periodically can make a difference. Conversely, let's say you're kind of on the opposite end of the spectrum and you move. You're always on the go, always on the go. Sometimes too much of a good thing can cause problems. If you're more of the kind of person who's on the move all the time, sitting down every once in a while, just taking a break, can help reduce pain and tension in the back. So those are 3 things that you can try to help with your back pain. There's moving around more. If you have a more sedentary lifestyle where you're doing a lot of sitting, having periodic breaks, if you have a really, really active lifestyle, to let the back relax. And then there's trying to spend a little more time with a neutral spine to avoid that slouch, avoid that kind of slump to the side position if you have a tendency to do that. Thank you for watching.
Pros and cons. Pros. All results were more favorable than those of past studies toward the benefits of physical therapy. Benefits of APT in this study may be attributed to focus on evidence-based interventions, specifically exercise and manual therapy, as core treatment components. The APT protocol used a repeat directional exercise program to central symptoms. Cons. Direct comparisons with other forms of exercise are lacking. This study has limitations. First, we did not balance provider time during the week treatment period, and differential contact time may have contributed to difference between groups. Second, the APT protocol was multimodal, and we could not isolate which components contribute to effectiveness. Third, the UC protocol standardized by the provision of education, which may not reflect what is typically done in primary care practice, for it was not possible to blend participants or physical therapists to treatment assignment. Fifth, our participant sample was 40, 43% with white and 46% non-Hispanic, which limited generalizability.
So back pain is a very common reason for an individual to visit their primary care provider. A number of patients who have back pain also have symptoms of sciatica, which means pain radiating into the leg. those patients tend to have a worse prognosis than individuals who have back pain alone. Yet despite the consequences of the presence of sciatica, there are a number of very important gaps in our understanding of what to advise primary care providers to do for this patient population. Specifically, the question of whether or not referral to physical therapy at this early stage of care benefits patients was an open question when we designed this study. So we recruited patients who had just had that initial primary care visit for back pain with sciatica. We asked them to either take a usual care approach, which was to just wait and see. Many patients recover fairly quickly without a lot of assistance, or we referred them to physical therapy for 4 weeks. And what we found was that the physical therapy option helped patients speed their recovery, reduce their disability to a greater extent over the 1-year follow-up period that we included in our project. No, I wasn't surprised by the results because the importance of keeping patients active, keeping them at work, helping them to remain physically active is something that we know helps across a broad range of musculoskeletal conditions such as back pain. It hadn't been demonstrated sufficiently for this particular patient population, but what we found is very consistent with a lot of other recommendations for patients with various musculoskeletal pain conditions, that activity, exercise can be beneficial and that physical therapists can help to provide that care. This is a really common population of patients, and what to advise early on to patients with back pain and sciatica is something where there's some confusion because there's been a lack of research studies that's examined this particular type of back pain. And we think it's important that primary care providers and that patients understand that physical therapy can help them accelerate their recovery, assist them in regaining their activity levels, and overall help to provide assistance in regaining their quality of life when it's provided early on in an episode of care.
Issue played in Ecuador. The 2016 Low Back Pain Guide of Ecuador recommended to the use of paracetamol as the drug of first choice due to a better risk-benefit profile. In the event that it is insufficient, an NSAID could be used if this is insufficient and could be used without exercise 14 days. Multidisciplinary rehabilitation when other treatments have failed and health is very altered. The teams formed by physicians, physiologists, and physiotherapists. This rehabilitation includes medical treatment. Rehabilitation includes medical treatment, exercise, and psychological treatment. Conclusion. Participants in the APT group had greater improvement from baseline to 6 months for the primary outcomes, OCW, and several secondary outcomes favored APT after 4 weeks. After 1 year, difference between groups favored APT for OSW and back pain intensity. Thank you.